We're live. Hey, it's Dr. Dan Purser, danpursermd.com, here for our Facebook Live on low testosterone in women with low testosterone. How about that? Works a little better. And I look like a doctor tonight, don't I? I did. You like this stethoscope?
Is that what a doctor wears?
On TV and commercials, and like House would wear them occasionally when he wasn't doing drugs, which I don't do, but yeah, so what do you think? It looks kind of cool, huh?
It looks great. I like how you labeled it.
I ordered it off Amazon, but I didn't want another doctor at my clinic to take it or anything, so I had to label it. So it's like a tie, a necktie.
Yeah, it's great.
Okay, yeah. I do use it occasionally. I've used it twice.
And on yourself?
No. No.
No.
Okay, so I'm taking it out because it bugs the back of my neck. Okay, so stethoscope is on. Okay, I'm going to go through my list, so get ready. Remember to follow me on Facebook, Twitter, Instagram, Pinterest. Have you seen my picture collections, Brecken?
Yeah, I have actually.
You have?
A lot of Disney stuff, huh?
Yeah, I'm surprised you looked at it. I love my pictures.
A lot of people have.
Every time I go somewhere around the world, I take tons of pictures and post them up there and kind of make comments about them. So, and a lot of people use my pictures, which is crazy. But so Pinterest, email, you got to get signed up for my email at danpursermd.com. Make sure you do, because we do sales, we do product sales, we do announcements, things like that. Like one of the announcements you'd probably hear about is that October 4th through the 5th, I am going to be in Bloomington, Minnesota at a Star Mori event. I'm the keynote speaker. I'm going to be speaking about 1,800 hours while I'm there, and talking about all kinds of things. We're going to be doing testing, going to be talking to people, going to be giving you ideas about your health. I've only agreed to do one event this year because I get overwhelmed. If you want to bring your crew or your team or your people or your peeps to that, please come and hang out with us. I'd love to see all you that I haven't seen in years and hang out with you. And we're going to have some of our goodies there and a lot of my books and stuff and videos you can get on USB keys, stuff like that. But contact Star Mori. You can see the link there and let her know how many hundreds of people you're bringing with you for your downline or your group. I'm trying to get some other people there to help me. There's some other speakers. It's going to be pretty cool. There will be 3 hours of questions and answers a session. I noticed that. Plus, I'm always available to answer questions all the time anyway when I'm there. I work the whole time I'm there. I'll be exhausted when I crawl back Sunday to Utah. So anyway, giving you a heads up on that. Books. If you need to get one of my books, tonight especially, you might want to download my Essential Oils and Menopause book. It will answer a lot of questions for you. Also, if you go to my website, the books, how you download them, go to greatmedebooks.com. It's all one word, greatmedebooks.com. And you can see all my books on Amazon. Download them, have fun, have a party, or buy them if you like the paperbacks like I do. And look at all of them. If you haven't got my books, it answers a lot of the questions. Like I would especially suggest the Women's Program 120, the Program 120 Women's Handbook B or Female Handbook B, because it talks about hormone levels, testosterone especially, a whole lot of information on testosterone in that book, and other hormones like estradiol, progesterone, stuff like that. If you have questions about estradiol, get my little estradiol book. And for heaven's sakes, you better have my progesterone book by now. Everyone who uses Progesterone Plus should have it. Even whether it's on Kindle or paperback, please grab it. So, Young Living Convention next week. We're going to be working from 7 till 5 every day, Monday through Friday next week. And if you haven't already got a slot, go to danpursermd.com and book some time. There are some times left. I did stretch up to 7 o'clock in the morning, but that'll allow some of you, so you don't miss your meetings, to come down. We're 35 minutes away by Uber or Lyft from the convention site, and we're just south of there, so it's not hard to get to my office and get seen and get out of there. Anywhere from 15 to 30 minutes to an hour for some of you. And if you bring friends and you've got an hour, great, you can all chip in and pay for it, and I'll see all of you. So do that. So I know I want all the slots filled because it's the easiest way to get to see me so I can legally prescribe you medications, especially testosterone. What else? Okay, let's dig into this. Is any other announcements I need to do? I've got like 48 people standing here. No, I'm teasing. There's like 3. But, well, my wife's over there. That's 4. But, so, you like these new big mics? This is crazy.
Oh, yeah.
It's like a nuclear missile aimed at me.
That is one thing to announce. We'll have these coming out as podcasts now as well. So you can listen to it on the road, not just watch on YouTube or Facebook. But
yeah. This is for podcasting. Isn't that why we set all this up?
Mm-hmm.
Wow. It's impressive. Okay. I don't know what to make of this, but young kids and their toys. Okay, so podcasting, where will it be available? iTunes?
Yep, on Apple Podcasts and on Spotify Podcasts, and most places you can listen to them, yeah.
Do I make any money off that? Not a penny.
No.
Okay, well, that's good for me. Whatever.
Just the
We can't monetize it, or no?
Not right now.
Okay.
the good of your heart. You're just giving these people the information
I
they
know.
need. You're generous.
You know what? I answer your questions on these kind of days and more tomorrow till my eyes bleed. Literally, I'm just like, I'm so tired. My eyes are the muscles are so tired from looking at my iPhone, looking at my iPad, looking at my laptop. Eye strain is humongous by the end of the day. I hope I can continue to see for another 10 or 15 years, or we're going to be in trouble. Yeah, that'd be horrible, wouldn't it? Okay, so let's dig into this. I know a couple of days ago, on Monday, I said this is going to be about PMDD and low testosterone. That was my mistake. But let me discuss PMDD really quick. I'm going to hit several high points right off the bat. PMDD, you just need lots of progesterone. That cures PMDD. It ain't complicated. Just use lots of progesterone and you won't have PMDD. Now, HSDD, it's going to be really easy to treat too. I'm really simple and usually lots of testosterone. Not enough to give you whiskers, not enough to give you, to break out your back. So a tiny, like 1/10 of 1% of you will, but HSDD is hypoactive sexual desire disorder or dysfunction disorder or something. Desire dysfunction or anyway, it means low libido. It's from low testosterone. If you're premenopausal, I'm going to answer your problem tonight a lot differently than I am if you're postmenopausal. And I'm going to tell you how to deal with your postmenopausal issues. It's a completely different deal at that point. If your ovaries are dead, gone, asleep, failed, moved out, blown up, whatever happened to them, then there's really simple how we treat that. And there's only one way to treat that. For young and living distributors, I do like 2 things. I like PD 80/20, but most of you take way too much of it. It's usually like twice a week. For most of you, it'd be sufficient. Maybe 3 times a week. Women readily convert DHEA, which is in PD 80/20, that's the D, and pregnenolone helps too, to testosterone. Women will do that. So PD 80/20 is magnificent. You should use it. So if you're not a young living distributor, grab some DHEA, 25 milligrams, and pregnenolone, 25 milligrams to take twice a week. And you'll get somewhat similar results. If you've had breast cancer risk factor, like your sister, your mom, or you have had breast cancer, and you're worried about getting it, you don't want to use oral PD8020. You want to use Progesterone Plus cream. That's totally safe to use, but not PD8020. If you have a strong family history of breast cancer, don't use it. So is that clear? Don't use it. So if it's no strong family history of breast cancer, use it. So twice a week. That will not stop vaginal dryness. I've probably dealt with hundreds of Young Living distributors with that problem. It just won't do it. So there's only one thing that will get rid of vaginal dryness if you're postmenopausal. It's compounded liposomal testosterone cream. I know a lot of you said you've tried that. I'm going to tell you right now, you haven't tried enough of it, or it was poorly made. There's something wrong with that story that it did not work. Or maybe you had an infection or something else. Maybe it wasn't really low testosterone. So I'm going to tell you what I did, and we're going to post it. So here's what I do. When I use, what I use with my postmenopausal patients, and rarely I use it with premenopausal. We're going to get to you younger ladies. So I use a compounded testosterone liposomal cream, 20 milligrams per gram. And I use 30 grams usually. If you're really severe and have to use it twice a day, I'll use 60 grams. I'll order 60 grams for the severe cases. So I use I have the women use 1/4 gram vaginally QAM. Once their dryness goes away, it can take months. Usually it takes weeks. But I've even seen it improve in days, or heard about it improving in days, but you need to use it consistently. And sometimes you need to double it up for a while to get it to work. But if it doesn't work, you recheck your levels. If they're not super high, like 60, 70, 80, 100, 125, you're probably getting poorly made testosterone, or probably being given poorly made testosterone, or weren't using enough of it, or it's just not compounded correctly. Because I've never had it not work with my patients over and over and over again. Look at the comments from patients of mine who left posts on Facebook in the comments section. You'll see the ones that say, wow, it worked really well. So you got to use compounded testosterone liposomal cream, 20 milligrams per gram, 1/4 gram, even 1/2 gram, once or twice a day according to severity. And I've never seen it not work. So, and then eventually you'll be putting a little vaginally and then a little inside your thigh, and that's it. It will not hurt your husband if he gets some on him. So, not a big deal. If he's using it and he gets on you, that's a different problem. So, does that help? Did anyone comment on that? Are they cheering, or are they throwing rocks at me, or they like that? Okay, so I'm gonna pick 3 women tonight who have low testosterone problems. I've sent a bunch of you messages that were interested in using you, that we're probably going to use you, or thinking about using you. So respond appropriately. We're going to pick the 3 from you. I want 2 younger ones and 1 who's failed testosterone cream. And so I've reached out to a few of you, I think 6 or 7 total. And we'll pick out of you 3, or we'll pick 3 out of that 7. Or 6 or 7. So just know that, don't get your feelings hurt. I'm looking for the right 3, so that aren't afraid for me to video them go to meetings. We're not gonna say how's the sex or anything like that. It'll be tasteful, tactful, vague, in anything we show. So it's handled very appropriately. This is a touchy subject. So, but that's one of my goals tonight, is to help 3 of you. I'm just gonna pick you. I'll do some of the testing, and maybe you can pay my costs on it, stuff like that. By the way, we've got 4 or 5 fibro cases because of some people that didn't respond, and then we reached out to some other people, and then the people that didn't respond responded. So we're moving ahead with all those, and we felt bad for them. And I'm supplying everything to them. I apologize that we're not doing this in this case, but and we're going to keep reporting. We're going to go to meeting videos. We're going to have it all posted. We're going to have lab results, everything else. You can see what's going on with those fibro cases. and we're going to make them better. And I'll show you step by step, video by video, how that works, so you guys can all go, woo, okay, now we understand how you get rid of fibromyalgia symptoms. So we're going to do the same kind of with these low testosterone cases. I want you to know this is an easy process. So now for younger women, let me see. Sorry, I got to go to my list here. Let me talk about some other things really quick. Breast cancer and testosterone. Testosterone has no cancer risk. It does not increase the risk for breast cancer. Actually, studies have shown that slightly decreases the risk for breast cancer. If your doctor says you should be on no hormones because you've had breast cancer, you need to probably find another doctor, because testosterone is okay to be used. Pellets versus creams. We use pellets too in our office, but to be honest, I like creams, or women like creams better. Men like pellets better, but women like creams better because they control the day-to-day usage, and the pellets tend to be over the top. For a lot of women, they don't like it. It scares them to lose that control, and it does cause some of the problems. So I'll use pellets occasionally, but with most of our female patients, it's cream, and they really enjoy it because they can use it. They can manipulate it the way they want. So PCOS and high testosterone. I've been asked by several of you to cover that. Here it is. PCOS, no one knows the cause, but here's what I'm starting to find. All the PCOS patients I've had are compound heterozygous, Mthfr. I don't know if that's just a weird thing I'm finding, or just by happenstance or what, but I'm going to keep looking. The other thing, the way you treat PCOS, the way I treat PCOS, is lots of natural progesterone, like either Prometrium or encapsulated progesterone, or they pour a bottle of Progesterone Plus on every day, or something. But they use lots of natural progesterone, and they use DCI, which is D-chiral inositol, 600 milligrams, and they'll take it, try one a day. It'll bring down the insulin levels and help with improve insulin sensitivity. And if they can handle it, twice a day, if it doesn't cause hypoglycemia. So that's how I treat PCOS, and it works every time. So, and their testosterone levels gently come down, their progesterone levels go up, they lose weight, and they feel really good, and they get rid of their high insulin, low hyperglycemia problems. So it all normalizes. These women, also give them MTHFR support and support plus, or for some of them who are big time living people, and we let them take, and I encourage them to take Super Bs and Master Formula, which I helped design both those. I helped reformulate on both those. So I hope that helps with PCOS. That's how I deal with PCOS. If you have PCOS and you want that addressed, contact me, set up some time in my office. It's so easy to take care of, and we can really improve your life. Idaho Blue Spruce and Shutron for women. I'm the one who discovered the Idaho Blue Spruce problem, and Shutron worked with Gary on it, but I'm the one who found it. Originally, we were just testing oils for high testosterone production, and the way Idaho Blue Spruce works, I'm the one who originally designed Shutron too. The way those work along with Gary again, he always had his hand in everything, but they would not work for women. I know you guys like to use Shutron for low testosterone. It doesn't have that effect. It's just not for women that we could tell, that we never saw work for women. Idaho Blue Spruce just isn't quite going to do it because of the chemistry, what's going on with the man, and this particular way it works. And just giving you a heads up. Let's see what we're going to cover next. Oh, so we're going to post some of these answers. Let me get back to another answer. This is what I do for younger women. This is what we're going to do, and I'll show you through the 2 examples we're going to pick. There's a reason why your testosterone's low. There's a reason why you have ovarian insufficiency or premature ovarian failure. You're malnourished. I know that sounds weird. You may weigh 300 pounds, but doesn't mean you're nourished properly. And so the first thing we do is, because we did this at USC all the time, the first thing we do is I get a SpectraCell micronutrient panel. And I'll also look at your genetics, because something's blocking your ability to absorb key nutrients. And that's why you're tired. That's why your testosterone's low. That's why all your hormones are low. That's why you can't get pregnant. That's why this occurs after 2nd, 3rd, 4th pregnancy, because you're drained of vitamins. So one thing you could take tonight is start with Master Formula. Take it, or a really good multivitamin like Thorne Basic Prenatals. I know you're not pregnant, but it's just a great vitamin for after you've had kids. I'm assuming you're going to have methylation problems. It's what I most commonly see, like MTHFR and those kind of problems. So, or if you want to know for sure, get the SpectraCell and get your genetics done. I can help you with both those. And that's probably what we're going to do with the 2 young ladies we choose. So we're going to help them get a SpectraCell, and they can have it at cost, and the genetic panel I want them to get. Thinking of that cost, is none of that's going to cost very much in reality compared to what it will help them with. And then magically, when you get the right nutrients in, your hormones come up. Just click, click, click. 3 to 6 months later, normal hormones, the fatigue's gone. That's the way this works. Quit fiddling around and worrying about your hormone levels. You need to worry about your nutritional status. It all starts in your gut. It all starts in your food. It all starts with your supplements. That's one thing we definitely found out. I hope that helps. So I think I've covered all the basics.
Real quick, just to reiterate with that. So your first step would be to get which testing done again?
A free and total testosterone, just to see where they are, make sure they're indeed low. Mm-hmm. That's what I'm like. I don't know if you guys have low testosterone or what's really going on with you. So we're going to check that first on those women, or get them to check it, get their doctor to check it, whatever, and then I'll know for sure. And then I'll order a SpectraCell if it's low, micronutrient panel, which is an intracellular vitamin mineral panel that looks at 39 different vitamins, minerals, amino acids. And if it's got a bunch of deficiencies, which I just about guarantee you it will, then we got to deal with those. But those deficiencies also tend to be in certain patterns that indicate genetic errors that prevent you from absorbing key nutrients. So the supplements you got to get for those are slightly different, modified, so you can absorb them correctly. That's the trick of MTHFR and the genetic things we design, like the MTHFR Support and Support Plus, or the way we had to fix Super B and Master Formula. So one thing we figured out, I don't know if most of you know this, but we had 1,000 SpectraCell results that I'd drawn on Young Living distributors at conventions. We used those results. We had to go through and remove all the names and identifiers and all that, so it's all HIPAA compliant. We used those 1,000 results to design Master Formula. That's how it was designed at Young Living. We knew about that, about those results. We knew what your deficiencies were. That's how we designed it. We knew what the top 20 deficiencies that consistently came up were, and so we made darn sure we addressed it. But what we also figured out from those results is that 85% of people that had SpectraCells at Young Living conventions probably had MTHFR or some other methylation problem. That methylation problem prevents you from using commonly used prescription medications, birth control pills. Prenatals make you sick, birth control pills make you crazy or sick, stuff like that. You can't handle regular medications. And so you go to essential oils and all natural stuff. It's what you've got to do that, or you'll just die. You have to find another way, another source, another option. And that's what drives you to Young Living. It's not like you magically chose Young Living. It kind of chose you, or you were forced to choose it because of your genetics. That's one thing we definitely figured out from the when we designed Master Formula. So, okay, so let's go with questions. Are there any questions, or has everyone left?
No, there's questions. Okay, I'll just start. I'll just dive in. So, first question, this lady is 39 years old, and she has 0 libido, and all the other issues you were mentioning above in your first post that you were posting, plus hormonal, like progesterone and estrogen frustrations. What would you start for her to recommend?
I'd want to see, I need a little better history from her. I'd want to find out, how long has this been going on? Has it been after pregnancies? What's happened? But then I'd probably want to get a SpectraCell. And I would want to see where her hormones are too. And then those are the metrics I would use. And then when her SpectraCell comes back, it takes 3 to 4 weeks. It's only 2 tubes of blood. But I'd send her a SpectraCell kit. Or if she's nearby, we could draw it in the office. And she can get it drawn wherever she is. And then she sends it in. 4 weeks later, we know the results. And we address those vitamin deficiencies. If the results show a B12, a pantothenate, a folate, a serine, a glutamine deficiency, all that kind of stuff, biotin, all that, it's MTHFR. And I would suggest genetic testing at that point. If it's just a bunch of random deficiencies, they got to be dealt with. One deficiency alone can prevent you from maintaining a pregnancy and can cause you to be fatigued, exhausted, have low testosterone, and everything else. It's just according to what deficiency it is. But 4 or 5 or 6 or 7 or 9, like we've seen, you've been there when I've opened those SpectraCells and we're like, holy cow.
Yeah, it's insane.
Yeah, it's crazy.
It's sad.
And there's people that are trying to do stuff. They're trying to live good lives, healthy lives, and they're just haven't got to the bottom of it. So, yeah, but the SpectraCell is the deal. And then their libido comes up, their testosterone comes up first, libido follows, and they get back to normalcy. They can go work out, they can go have fun, they can go to Disneyland, all that without wearing out. So That's what we do.
So a question that I'm getting a lot now is, what would you say is the recommended testosterone level that you want women to be at?
It's all according to age. Postmenopausal, I don't like 0. That's what everyone says it should be. Most women who are postmenopausal, or my patients, don't want 0 testosterone. That's horrible. That's how you get super dry and miserable. Most of them want it anywhere from 55 to 125 nanograms per deciliter. So 55 to 125. Some like it higher, some like it not so high. It varies. I let them decide so they can figure it out because their bodies are all different.
Yeah.
And they'll go, I feel really good where I'm at. I'm like, let's memorialize that. Let's check your level. Your husband likes it. You like it. Your libido's good. Yeah, because it can get bad. Your libido can go through the roof. And that's really annoying for women. I've had some had to call me or text me going, thanks for the testosterone, but I'm orgasming every time I hit a bump in my truck as I go down the road. This is freaking horrible. And I'm like, okay, you need to back it off, way off, or you're going to go crazy. And they will. It sounds all fun and good. You guys are laughing, but it's not good. It's a bad thing. And some, it's just a variety. Everyone's different. But that doctor needs to be cognizant of that and not try and staple everyone into the same little tight range. It varies for women. And women, I'll tell you exactly where they like their testosterone.
So what about before menopause? I know you gave like the postmenopause. Is it
Same.
kind of the same range?
Same.
Cool. Yeah, someone commented that theirs was 17.
17's super low.
Okay.
17's in Grandma Jones goes to the funeral home low. Now it's just bad. 17's bad.
Yeah.
Especially if you're 39 or whatever.
Yeah. Okay, and the next one is, this is just a comment someone had. They're 38 years old, they have 1 ovary, everything else is moved out, that's the term they used, and unregulated blood glucose. Do 3 injections for that. They use Progesterone Plus and Master Formula and Mineral Essence daily. Do you have any suggestions? Other than that, in their Young Living.
1 ovary is not enough. I know that I have 1 testicle that functions. It's a problem, because of my wreck in 2001. It's not enough. You're gonna need support. Probably you need to be treated like you're postmenopausal, and just go with the testosterone cream and the PMDD, or sorry, PD8020. Too many acronyms. PD8020. I don't know if that'll be enough to power your ovary into making a little testosterone, but probably not. But take it anyway, twice a week at least, and get on some testosterone cream. And if it doesn't change, you're not taking enough testosterone cream.
Yeah.
Okay. Next question. I'm trying to stare at the
I
whole
know.
thing.
I get distracted too. Someone says, does this affect energy? I'm assuming.
Yeah. Yeah, but you can have really low energy because you actually have a bunch of horrible vitamin deficiencies. And they make you really tired, brain fog, feel horrible. And yes, your testosterone's low. So you can feel really good and still have low testosterone, but they kind of go hand in hand. So you want to have a high testosterone or high normal or optimized testosterone, as we say, on that list of 30 plus benefits for women and optimizing their testosterone level, whatever that is for that woman. But mostly you need to make sure they have no vitamin deficiencies. I see it over and over and over and over again.
Yeah, it's common.
It's the most common cause of low testosterone in someone who's premenopausal. They have a bunch of horrible vitamin deficiencies caused by some genetic disorder they have and they don't know about.
So that's a question that someone was asking. What are the common genetic issues / genetic errors that you tend to find?
All kinds of methylation problems: MTHFR, MTRR, MTR, MTHFS, MTHFD1, MTHFD, COMT, a lot of COMT, NAT2, just mostly it's the methylation problems that are biggies. But you can also have like NDUF-S7, NDUF-S3, stuff like that affects your CoQ10 and PQQ levels, things like that you need.
So how do you recommend getting tested for those? People are asking.
Genetic testing, get it. I do the methylation testing. Get it. You can just order it from our website. It's super easy. You swab. I've shown you guys how to do this. You swab one side of your cheek for 1 minute, and then the other inside of the other cheek for 1 minute. Then you put it in the mailer. Then you mail it off. You can order it from my website. Get the methylation one. I think it's $289.
Yeah, I think it's actually $249.
$249.
Maybe $229.
Well, for you guys, it's $249. Well, maybe.
Let me look.
Okay. Anyway, whatever it is, it's cheap, and then you'll know. And if you want me to help you, guide you, and tell you what to take for those problems, they're listed on there. But what to take, but I can guide you more. And boom, the world changes and starts to change, and you feel amazing. So, and if you feel that bad, you're gonna have a lot of methylation problems. 9 is kind of average. I saw 14 today. That was pretty crazy.
Ooh.
14 methylation snips.
Are they okay?
No. No. And their kids have problems too. Really, yeah. So it kind of broke my record. 13 was the most I'd say.
That's crazy.
Yeah.
Okay, next person. This is kind of, it's just a question. I don't know if it really is testosterone related, but ever since they started their cycles, they've had severe cramps and pain. Also cannot get pregnant and haven't been able to do so for 15 years now. What testing should I have done, or what suggestions do you have to help with these issues?
Get a couple of progesterone levels, one mid-cycle, one at the beginning of the cycle, just so I kind of see where they're hanging. Get a free and total testosterone, get an LHFSH. I want to see your estradiol level too. And I'd get a SpectraCell from my website. That, you can put it all together. We can figure it out. We can figure out what the heck is going on before you get too old to have kids, and we can get rid of the PMS and the other problems. Something's wrong. I'm guessing you have some genetic error, so we'll probably end up doing that too. If you want to just be comprehensive, get the little methylation kit from my website, danpursermd.com, the testing section. Does it say genetic-testing? Is that what it says?
I think so,
And
yeah.
I just posted it too.
Okay, good. So it just got posted. Grab one of those. Or, and please, let me tell you one other thing. Don't go have IVF. Don't go see the fertility doctor until you've done this stuff first. This stuff's cheap. You go in there and you pay $12,000 for the IVF when you should have done this first, and find out if you have vitamin deficiencies or genetic errors. Really? They don't do any of that. They won't check any of that. They just give the IVF and goes, it fails, it's $12,000. So let's do it again next month. You're like, what? No, we sold our dog and our car for that. So don't, because so many times they get the IVF failures and for fertility issues, and instead we do all this and they have a baby, they get pregnant. So
It's amazing.
it's the way it is.
Yeah.
Start with the basics. Basics are vitamins, nutrition, genetics. They don't do that. IVF doesn't do that. They don't. And really, you can get all that done for $1,000 or less. So, not 12,000
Yeah.
for her.
Right, people paid 24 or 30,000.
I know.
Crazy.
I know. I saw a girl last week who paid 36.
Ugh.
And you know what her problem? She had massive vitamin deficiencies and stuff. I was like, yeah, you're probably going to get pregnant. Sorry you spent all that money.
Yeah. Someone says you mentioned testing progesterone at different times. Should you be testing testosterone at different times during the month, or is it just?
No, it's just high. Or it's just high or low. If it's 17, it's going to be 17 3 weeks from now or 2 weeks from now. Might be lower.
Someone asked how much PD 80/20 for postmenopausal, and how long do you keep taking it?
Forever, 2 a week.
So 2 a week.
I'm feeding for a woman 2 weeks plenty. For a man, even for a man, probably 2 weeks plenty. After they've taken it for a week or two daily.
Do you start with 2 a week, or do you just try one a
I'd
week?
start with 1 a day for a week and then go to 2 a day. It'll break you out. You'll get acne, deep, painful lesions. That's DHEA or pregnant one. You combine them. If you're taking it every day, it's going to do that. You'll hate it. But twice a week's perfect.
Yeah. People are asking, can testosterone, some people have been asking high, some people have been asking low, cause facial hair growth?
Nope, never seen it. Doesn't do it. You do get facial hair growth postmenopausal when your hormones are low, but it's nothing to do with testosterone. Forget that idea. No. I have seen a couple of possible pattern baldness problems, male pattern baldness problems in women who had too high testosterone. We backed it off, and then I checked their vitamins. Usually it's a vitamin deficiency almost always, and we dealt with that. I don't know which it was. Was it the high testosterone, the vitamin deficiencies? But anyway, the hair came back. So I think it was just vitamin deficiencies. So I can't even tell you if I've seen that. And I probably treated 2,000 or 3,000 women with testosterone. When I go out and speak to large crowds, like at that Star Mori event, when I go up there, the 500 to 1,000 people that are going to be there, trust me, there will always be a dozen women afterwards who will go, I have this problem. I'm really dry down there. My husband, we're just done. And he's going to divorce me, and I'm horrified. And I'm like, let me help. Come to Utah, let me see you so I can prescribe it for you. Let me help you with this. And they do, and so we take care of it and problem solved. I've never seen it fail. Boom.
It's amazing.
Yeah, and if they're doing it, and you're not getting the results that I'm talking about, you're going, huh? I tried it, it was terrible. You had other issues, other things, vitamin deficiencies, something else someone was missing, or just bad testosterone cream, or you weren't using enough.
Next question is,
It's hard because you're
yeah,
there,
I
and
know.
I'm like,
do you want me to sit over here? This lady is 55 years old, has PCOS, hypothyroidism, and hypertension.
very common.
Yeah, hasn't.
Those all go kind of hand in hand.
Interesting. Hasn't had a period in over 4 years, so I guess she assumes she's
How
in
old is she?
menopause. She's 55.
She's in menopause.
Yeah, she has painful relations, awful dryness, and facial hair. Also, extremely low sex drive, almost non-existent, and feels awful.
She needs progesterone, she needs testosterone, and she still needs D-chiroinositol, the 600 milligrams. She still needs it. Hasn't changed. She's still PCOS, and she needs her genetics tested. Get the methylation kit, because I'll just about guarantee I'm going to find out she's got compound heterozygous MTHFR. That's where we have one of each, and she's going to be a sick puppy, but it's all right. She can get a lot better and live the last 50 years of her life amazingly well.
Yeah.
Or last 70 years of her life.
7 years.
Exactly.
125.
Yeah.
So next question.
Good.
So this woman had a complete hysterectomy at 25, Finally, years after synthetic hormones, she's getting BioT pellets. At the same time, she found out her thyroid was not right and has had horrible hair loss, fatigue, fibro, and is having flare-ups again. She's your chronic everything, huh?
Well, what would you do first?
Me?
Yeah, look at her. She's doing some things right.
She needs to get her vitamins.
Bingo. Yeah, start with the basics. Always start with the basics. You guys, everyone puts the cart before the horse, or the carts before a horse.
Yeah.
And you need to start with the horse. You need to check nutritional status. That's through a SpectraCell, a micronutrient panel. It looks at intracellular vitamins and minerals. That's why I do it so often, because it'll answer her questions.
Everything, yeah.
Her hair loss is probably from the vitamin deficiencies. Though again, it could be male pattern balance, but I just don't believe that happens in women. I just have never seen it.
Yeah.
But with those BioT pellets, we use BioT too because they're the best ones. Someone tells them it's your BioT that's doing them. No, it's your vitamin deficiencies that's causing your hair loss. There's a book by Spencer David Coburn, Kobrn, called The Bald Truth About Women's Hair Loss. Is bar none the best book on women's hair loss. And if any of you have women's hair loss, get that book and read it. And then get a SpectraCell, because he concludes that it's almost always vitamin deficiencies that cause hair loss. Remember, I'm in a cosmetic reconstructive surgery group, and we get a lot of women with hair loss issues and they're wanting transplants. We don't do those because instead we fix their problem.
Yeah.
We go to the root cause.
So a question that came up with that is someone said at one point they were taking BioT, or they had BioT pellets, and at another point they had shots of testosterone. What do you think about that?
No, I don't like it. Don't do it. I have one patient who does shots. That's because another doctor gives them to her and she likes them. I don't touch that. I don't do it.
Interesting. Next question. 41-year-old with a total hysterectomy 12 years ago. For the past 12
29,
years.
she was 29.
Yeah,
Wow.
that's so young. For the past 2 years, she's been using her Young Living oils to support hormones.
Good.
What supplements can I add in to get them where they need to be?
Well, master formula, for sure. And if she thinks she has Mthfr, try 1 Super B a day. Maybe try 2. Do the master formula 3 or 4 days a week, or maybe to begin with. After a while, you can drop it to twice a week for the master formula. Just because it's expensive, it's always out of stock. Why it's out of stock, I have no idea. We can still fix that for them. Anyway, and take the Super B. If she needs more help, a SpectraCell and a genetic panel through me. I'd love to chat with her, but she can probably deal with most of this on her own.
Yeah.
I'm giving you guys the options. Wow. Boy,
Drink some water.
Can't do. That's why I keep that there, water. Okay. It could be something else, but it's not. Start with Master Formula. It's a great vitamin supplement. Probably one of the best ever in the country. So.
Yeah. Kind of going along, I know earlier...
If I choke to death, does this end early?
I guess. Everyone will be part of your funeral.
Wow, watch the event. Okay, go ahead.
That's great.
I'll start talking more.
I'm so glad you guys have figured that out. Okay.
Yay.
I'd be calling 911 if I'd start choking. Okay, go ahead.
Nah. Just kidding. So people are asking for like testosterone tests. Do they need to go to their general practitioner, gynecologist, or...
No, your family doc can do it.
Cool.
Get a free and total. Man, I'm going to have to call this. No, get a free and total. Free testosterone levels in women. Do not pay attention to those. They are inaccurate.
You can take a break if you need to step away for a minute.
Yeah,
You're
do you need
all
to
right.
step away?
No.
We can entertain them.
Yeah.
Free and total testosterone.
Sorry,
Okay,
guys.
this is
Just one
horrible.
sec.
So free and total testosterone is what you want. It's cheap. I think it's like $73 we charge for it. Okay, now I'm better.
There we go.
Okay, free in total. The free, in women, it's inaccurate. You can't pay attention to it. I never look at it. I look at the total. If your doctor goes, wow, your free is really good, go, thank you. And just ignore them. Because after years of endocrinology research, the free is worthless. The reason you get them together because it's cheaper to run it together than to just ask for a total testosterone alone. That's like $105. So dumb. But you got to get them both together. Does that help?
Yeah, that's great.
I think I'm dying.
Yeah. Do you need something?
No. Yeah, new throat.
Someone suggested thieves lozenges.
Yeah, I've got one right in there by my bathroom sink.
Oh yeah.
Let me go grab it.
Yeah, you go and grab it.
I'm grabbing it. Everyone's cheering.
He's gonna go get a lozenge.
Yeah, I've never done this before.
I know. He's made it all these Facebook Lives, and he's made it through every time. No problem.
Oh no. What? Oh. So, if you guys have more questions, just keep asking them and I'll keep reading them. But a lot of our questions, he answers a lot of questions in the beginning. If you guys are missing anything, don't forget that this goes back on, once this is all over, you guys can watch it on YouTube, on this, as many times as you want. Share it with people because it's really good information that people just need to know and don't get to know often. So,
I'm
look.
getting back and I've got my thieves lozenge.
Good, because I'm not very good at talking.
Ooh, sorry.
Good.
Kind of shaky.
I'm already better.
Good.
Put the wrapper here.
Okay, shall I
Okay.
dive back in? Okay, this lady is 26. She hasn't had a menstrual cycle since she was 13. And she knows she has low hormone levels and suffers from all the symptoms listed above. Do you think there's any possibility for her to get her body to have a menstrual cycle after so long?
Yeah, I deal with this all the time, yeah. It could be pituitary dysfunction. Remember, I did a lot of years of research in that area. But these lozenges like magic. I know, but that's why I keep them around too. But it's probably vitamin deficiency. It's probably genetics. She probably has blonde hair, blue eyes. She's tired all the time. And she has Mthfr and 9 other methylation problems and a bunch of other little annoying genetic errors. That won't kill her, just make her life miserable. So, and we can deal with all that. She needs to probably start with the genetic testing. That's what I would do. And maybe get a spectral cell too. You're talking really 789 or 749 for everything, and it will answer the world for you. So if you want the bigger genetic test, let's say like you have a big anxiety component, you want to get the bigger genetic test. So you're looking at 500 plus 500 for the spectral cell, $1,000, and buy an hour of my time, and let's talk about it all. We'll figure it out. Cheapest investment in your health you'll ever make. Okay.
People are wondering if you can take master formula with PD 80/20.
Yeah.
Cool.
Yeah, it should. PD 80/20 is one of the great products that attracted me to Young Living to begin with. When they approached me about my textbook and wanted me to start speaking back in Minneapolis, Rebecca and Gary and the team all found me. So
That's great. People are wondering if they can. There's a couple questions. People wondering mixing if they can take Progesterone Plus with testosterone cream.
yeah.
No issue.
Yeah.
Kind of.
You can take Progesterone Plus if you've had breast cancer too. You can take testosterone if you've had breast cancer.
That's great.
So the next question you're going to ask me is, what if I have progesterone receptor positive cancer? I don't care. You just take it with Progesterone Plus still.
Wow, I never even heard of that.
We have PR positive or ER positive breast cancer. ER is estrogen receptor positive. Progesterone receptor positive breast cancer. Because progesterone causes, what does it cause? I've taught most of you, you've listened to me over the years, causes apoptosis of breast cancer tissue. So you pray it has progesterone receptors on it, because then you can load up on progesterone and it can really help kill the breast cancer. It won't cure you, but it helps the battle.
Yeah. Sorry. finding more issues or questions, not just issues. So this lady's 51, had a full hysterectomy at 48. She's a total mess, she says. No libido, so dry it feels like sandpaper, and unable to use hormones because of my high cancer risk. I know you had some kind of recommendations.
Testosterone won't cause any cancer, Rose. Neither will progesterone. 1981 American College of Epidemiology review of over 50 studies with progesterone prior to 1981. Yes, they've been studying this stuff a long time. And what they found is that a 500+% decreased risk of breast cancer when you use progesterone at any age, or when your level's high enough at any age, and a 1,000% decreased risk of all breast cancer, of all cancer risks overall. 1,000%. That's progesterone, natural progesterone. Yeah, my progesterone book studies in there. So, so progesterone, she can use progesterone and she can use testosterone because they won't cause cancer and it'll get rid of her dryness. And she can use estradiol or estrogen or clary sage. Clary sage is a great option. It works really well in place of estrogen. I suggest clary sage all the time.
Yeah.
So, it just works. Clary sage works great. 8 drops in a capsule in the morning. If you want to apply topically, you can, but you'll smell like clary sage all day. Which isn't bad.
Yeah.
That's why a lot of people like to use fluorescence or Lady Estro or whatever they are, Estro or whatever they all are. Estro is the tincture, but because fluorescence smells a lot better. But it's still sclereol, which is the active component of clary sage. Okay, I've said enough. Okay,
No,
next
good.
question.
Someone was asking if you think there's any relationship with low testosterone and head injuries.
Yeah, pituitary dysfunction, you got to worry about that. Yeah. But until you've looked at vitamin deficiencies, until you've had someone who really knows the pituitary, you've been to the 10 or 12 doctors in the country who really understand pituitary dysfunction, you don't know. So I'm always looking for that. I've found a few cases over the years, but not many. You better separate out the dwindles from low vitamins, so vitamin deficiencies, because they'll cause low pituitary output and low ovarian or testicular output too, low pancreatic output, low everything output if you're malnourished. Okay. Does that make sense?
Yeah. It's just crazy.
You're just saying yeah because I'm your dad, right?
Have to. I'm sitting here. I have
That's
to just
comforting.
agree with everything you say, right? Just
Or
kidding.
we'll fire you. Yes.
Next question. It's kind of got some PCOS questions if you want to answer those.
Yeah.
Cool.
Yeah, that's cool.
So
Let's keep going. We can go to
Yeah.
8. We can go another 25 minutes or so.
So this
Maybe
woman,
later.
Yeah. This woman has facial hair, deep voice, and has been through menopause at the age of 42. She's currently 56, and she's been told she has high testosterone and PCOS and doesn't know what to do. I know you kind of answered this.
Yeah, I
but-
did. Yeah. DCI, D-carolinostol, find out your genetics, and progesterone.
That's great.
Progesterone lowers testosterone levels.
So it's the opposite problem of a lot of these other women, huh?
Mm-hmm.
That's interesting.
It's a lifelong hellish problem.
Yeah,
But you have a sister with
think so.
PCOS and all that.
Yeah. Next question. This lady had 3 kids in 3 years. Whew. She's currently nursing
Very
and
common.
Is that?
Yeah.
Whoa. She's currently nursing and dealing with a couple of the symptoms that you've mentioned. Could it be low T causing her fatigue and...
It's vitamin deficiencies.
Okay.
Get a SpectraCell. That's where I'd start. It's not cheap, but it's not expensive, and it will save your life. It'll make your life 100% better. It'll make you normal again, the results, if they're used wisely. It's so easy. Get the SpectraCell. You're malnourished. Your kids have sucked the living vitamins out of you.
Yeah.
And most prenatals are really poorly designed. So...
Couple of questions, like I've had this a couple times, is Does testosterone and progesterone convert into estrogen?
No,
Okay.
neither. No. They cannot go backwards or weirdly into another pathway. Don't do it. They don't do it.
Is there a Young Living product for testosterone for women?
PD8020. I know you're going to hear about Shutron or Untitled Chapter. I just explained it. Trust me, the science isn't there. It doesn't work. Works great for men, but it won't work for you. PD8020 is going to, or Progesterone cream is your only options. If you're young, take Master Formula and Super B because you probably have Mthfr, and you'll see a big improvement in your numbers. If you're postmenopausal, and just I've given you your only option: PD8020 or Progesterone Plus cream and testosterone cream, compounded natural testosterone cream. Sorry, I'm the guy who looks for other options. I just haven't been able to find anything for you at this point other than that.
So one lady's wondering, like she is a specific pharmacist in an NP that's helping her with her bioidentical.
Nice.
Yeah. She's wondering if those are okay to use or she should venture for more natural products.
No, but I think she's getting the right stuff probably. Yeah. Yeah, no, you want the bioidenticals.
Yeah. And as long as she's feeling good, right?
Yeah, well, what do they think? What do you think is in PD8020? Those are bioidentical hormones. What's in Progesterone Plus? Bioidentical hormones. You guys are using them. Sorry if you didn't know that, but you are, and they're good for you. So they're just, it means molecularly identical to what you make.
Yeah.
It won't cause cancer. It won't do anything. Gary's right. All this natural stuff will not cause cancer.
They'll prevent cancer, right?
Actually, it does.
Yeah.
Even testosterone shows a reduction in breast cancer risk when women use it. If you've had breast cancer and you're dry, shame on you. Use testosterone cream. So get it. Quit that ridiculousness. And if your doctor says no, it'll cause you to have breast cancer, find another doctor, or you know where I'm at. So.
Yeah. Kind of off topic, but do you have any recommendations for osteoporosis?
Yeah, I get a SpectraCell. Yeah, I deal with horrible osteoporosis cases. I get the failures, the bisphosphonates failures that have had the jaw erosion problem, where the jaw rots because of the bisphosphonates. It crystallizes and falls apart, or the roof of their mouth caves in. I get those. And really bad osteoporosis. So, and we can flip them around. Yeah, you need all the hormones because it drives minerals into the bones. You especially need testosterone because it's really good about doing that. You need a SpectraCell so we can find out what horrible deficiencies you've gotten. And that's what they should have done with you before they put these people on bisphosphonates. They don't do those. They don't even know that test exists. Between those two things and dealing with if we need to, we'll dig into your genetic issues. You can flip. I keep saying this. I have a book on osteoporosis. Find it at that great medebooks.com and order it. Kindle version cannot be expensive. It's got to be cheap. Order that or get the paperback. Give it to friends with osteoporosis, all that. It's all about natural options for osteoporosis. It's the only thing that works, in my humble opinion. The natural options are it, and you can flip it back to normal, but hard bone.
Yeah.
I've dealt with dozens and dozens of cases. We've done that well.
I've seen those cases. They're crazy. So next one, this woman is 56. She's been on menopause for 3 years. She uses Clary Sage for her hot flashes.
Nice.
She should
and Progesterone Plus for hot flashes.
She needs her she needs that.
Yeah.
So
95% of the time, hot flashes are from low progesterone. 3% of the time they're from low estradiol. 2% they're from low testosterone. About 1% they're from thyroid or DHEA problems.
But minimal, majority of that's progesterone. It's crazy.
Yeah.
She has joint pain in her elbows and feet, which is her feet are really severe. She says she has really low libido, feels exhausted no matter how many hours of sleep she gets. What are some recommendations you have for supplements?
She needs progesterone, she needs testosterone, and I'd look at a SpectraCell. I'm wondering if it's got a B12 deficiency causing the foot pain problems. She probably has Mthfr. Remember, I'm going with the numbers. 85% of Young Living distributors have some type of MTHFR problem.
Yeah.
It's just where it's at.
Yeah, really.
So it makes me sound really smart to say, wow, she probably has MTHFR. Yeah, 85% chance she does. With her symptoms, I'd say 98% chance.
Yeah. We see so many MTHFR. It's like
Tons,
everyone
every
walks
day.
in the door. It's shocking when they're not MTHFR to me at this point now.
Wait, we've had one? No. Yeah. I think we've had one.
Yeah, I don't even.
They had a lot of other methylation
But
problems.
they basically looked like they had MTHFR, right?
Yeah, they did.
That's what was
The
shocking.
vitamins but they did have other methylation problems, which will give you the same problem.
Which is same thing, yeah. Just crazy. So someone, they're like, I'm sorry, I'm a little confused. They're 50. They're wondering if they should be taking master formula. They know they need the testosterone cream because they can't take PD 80/20 because of breast cancer risk. But should they be taking master formula?
Quinolone Plus cream. Yes, master formula always 2 or 3 times a week, probably 3 times a week at her age. And progesterone that will not increase your breast cancer risk. It decreases your breast cancer risk. I don't care if you've had it or not. Testosterone, master formula, Quinolone Plus cream, which is not PD 80/20, but it's the cream version. It will not increase your risk for breast cancer. I keep telling you guys that. So, and get a SpectraCell. Find out what if that doesn't work, let me do this. If that doesn't work after 3 to 6 months, then get a SpectraCell. Because you're missing something. That should work, though. That's a pretty good coverage.
Yeah.
Okay.
Covers the baseline. Kind of on that same, like, breast cancer survivor, they're wondering...
This is a really good lozenge.
I bet it's
I
helped
think
your
I'm
voice.
getting high on it. Wait, you took my wrapper.
You're playing
rolling
with
it
it. Distracted.
Oh, sorry. I'm listening to the question.
So this breast cancer survivor is wondering if you have any recommendations who's having hot flashes, but is supposed to stay away from estrogen and any hormone supplements. So like you've been saying this whole time, she doesn't need to stay away.
Needs to stay away from estrogen if she's
But yeah.
ER receptor positive. But they just kind of blanketly say, don't use the other hormones. Show me where in the literature on PubMed where progesterone causes breast cancer. Just because it's progesterone receptor positive, it's not a cause and effect relationship. It just happens to have progesterone receptors on it. Progesterone will not cause breast cancer. It does not cause breast cancer. It has not ever caused breast cancer. So she should stay away from estradiol. But she can use clary sage in place of it. It reduces breast cancer risk by 30%. She can use testosterone cream, and if she was really brave and would listen to a really smart doctor, she'd use progesterone. Don't use DHEA, but I'd get some Quinolone Plus cream and use it. Don't use the DHEA orally. It's the oral DHEA that increases your risk for breast cancer. That's what the studies have shown.
It's interesting. It's amazing, actually. People are wondering why you should only take master formula 3 to 4 times per week.
You can take it daily if you want. I know what's in it, and I don't know if everyone needs it every day.
Yeah.
And plus it's always out of stock, so make
Ration.
it last long. Yeah, ration it. We treat it like the gold it
Be
is.
afraid.
The platinum it is. But yeah, you can take it daily. I'm fine with that. I don't know if you've been taking it daily for a while, it's easy to go to 3 or 4 times a week and save money and maybe replace it with a PDA or not PD 80/20, but a Super B those other days you're not taking. That's the way I do it.
Yeah. Next question. This person is having insomnia issues taking her bioidentical progesterone. It used to help in the beginning, but now it doesn't really work anymore for sleep. Do you have any recommendations?
It's not taking enough.
Ooh.
Or she's getting the poor quality of it, or I crunched up these lozenge.
We all heard
like,
it was like
was
ASMR.
that tasty? I was dying to do that. So something's going on there. I'd want to see her levels. I want to look at her other levels too. Something's going on.
Yeah.
But no, it never doesn't do that. It always helps with sleep if it's quality progesterone. It never stops.
Yeah, it knocks me out every night.
Yeah.
If I
And
don't
you're
do
like
it.
14. How old are you?
23 now.
Okay, you're always 14 to me.
Yes. That's funny.
So is Jackson.
Obviously, with a beard, a 14-year-old with a beard.
He always was precocious. Okay, go ahead.
24-year-old taking master formula every day.
Good.
She's losing hair, but she's on birth control. What can she do?
Well, you know, everyone in the crowd knows what I'm going to say. I'm going to say, quit the birth control pills. You're having an androgenic reaction to it. It's nailing you.
Mm-hmm.
So quit the birth control pills. Use something, condoms, creams, balms, avoidance, something.
Abstinence.
Yeah, abstinence. Is that what it's called?
Avoidance. No.
Avoid that guy.
Just run away as soon as your husband comes in the room.
Well, you're assuming she has a husband.
Oh,
but-
sorry. Boyfriend.
Yeah, whatever. Yeah.
Yeah.
Significant other. Yeah.
Anytime a male
It's
comes
the
in the room.
yeah. So it's the birth control pill causing the hair loss. But she may have vitamin deficiencies
check
too.
it out.
But taking master formula, I doubt it.
Yeah.
So, because that covers the basis for all these MTHFR Young Living distributors. Yeah, that's why we designed it the way we did.
Yeah. I know you answered this earlier, but we've had it a couple times. Where can people get testosterone cream from? They can't.
Compounding pharmacy. So what you do, here's the secret. Here's how you do it. If your doctor, you first ask them to help you. I said the dose of the testosterone, 20 milligrams per gram. Get 30 grams. Use 1/4 gram QAM every morning. That is vaginally until the dryness goes away. Then you can kind of swap it between your vagina and your inside your thigh. But if your doctor won't prescribe it or says no, and you're desperate, you got two options. Go to the local compounding pharmacies, talk to the pharmacist and say, do you have a good doctor who will prescribe me this testosterone cream you make? Because I need it, I'm desperate. And they will say yes. They'll give you the names of 2 or 3 doctors. Ask for a kind, understanding doctor who really knows how to use it, and they'll tell you immediately who that is, because they talk to those doctors every day, or at least 3 or 4 times a week, if not more often. And they know exactly who they are. They refer patients to them all the time. They know who those people are. So that's what you do. If you don't have any results or can't do it with that, I'm here. Dan Purcher MD at danpurchermd.com in Linden, Lindon, Utah, not London, but Linden, Utah. I'm 35 minutes south of downtown. If you're at convention and want to come down and see me and have time booked already. But super easy to see. You'll have to get out here to see me because it is a highly controlled substance, but I can help you get very good quality progesterone and testosterone, and we'll do it right.
And you have patients.
I know all the rules. Yeah, I get patients from all around the world.
All around the yeah.
Yeah, mostly here in the U.S., but yeah.
They just want to see
New York, Florida, Maine, Vermont,
Texas,
Arizona, wherever.
North Dakota,
California, Oregon, Washington, Idaho.
Hawaii.
Yeah, I've got 4 or 5 from Hawaii. Can you believe that?
We try and visit them, right?
Yeah, that's what we do. No.
I wish.
Well, we do, but if they're watching,
Hi.
aloha.
So I have a couple MTHFR questions. We've had a couple. If you have MTHFR with low vitamin B12 levels, should you be taking master formula every day?
Yeah. Or at least Super B every day, master formula 3 or 4 times a week. Wow, that's going to get old. I don't want to make y'all you master formula lovers. Remember, I'm the guy who mostly designed that. I don't want to make you mad. Just, yeah, take it daily if you want. If it makes you happy, take it twice a day.
Yeah.
So if you're super rich, like you're a royal crown diamond, blue, emerald, sapphire, superstar, nuclear person, take it twice a day because you can afford it.
Also, you have an MTHFR support product that works really well too.
I do. Yeah, we think ours is really good. Good point. If you're taking Super B and master formula, like, I'm not feeling it. I'm not feeling it as good as Dr. Purcher said I would. Nothing's perfect for everyone. Yes, I love Young Living products. Yes, I helped design a bunch of them. Yes, we manufacture some of them. Yes, we love their products, but they're still not perfect for everyone. Nothing is. I wish it was, but man, Living would be a $20 billion a year company if it did that, or $80 billion, but it's just not that way.
Because everyone's different and unique.
Everyone is different and unique. They have different genetic issues, stuff like that. So you might want to try the MTHFR Support or Support Plus if you know you have MTHFR and aren't doing well. Please grab them. You can go to physiciandesign.com. Shipping is free. We also have specials like 3 for $100 or 2 bottles of glutathione for $100, stuff like that you can find.
And that's still live right now.
Yeah.
Oh, those
right
are still
now,
live. I just got informed. Those are still live. And we do case lot sales around holidays. And you can buy it and it'll last forever. Trust me. I know there's like a 2-year shelf life limit, whatever. They're still good 5 years from now if you keep them in a cool, dark place and closed. So,
I go through my bottles too fast for that.
I know you and everyone's family. So, so yeah, they're really good options. We think we have the best base support MTHFR product on the planet.
Yeah, it's on Amazon too.
Yeah.
Find it everywhere. So
And our
someone's
sales go up about 20% a month. It's crazy how many people are finding that every month.
we're glad because we just want to help people.
Yeah.
It's a big problem. Someone's wondering if taking B vitamins will make you shaky if you're low in B vitamins, or specifically B12. Is that something else?
But you'll be shaky. Look up tremor and B12 deficiency. Google it. You'll be shaky because of it.
Yeah.
Has
So
that
it's-
whole thing improved with you?
I don't shake anymore, and I've been taking I used to be so bad. Like, look, I don't want to put my hand in front of the camera.
That's a B12, yeah.
I used to be so bad.
Yeah, no, I deal with it all the time. I realize that now.
I thought I had Raynaud's or something. I don't even know.
I know, and they get told, like I had a lady today was told she had Parkinson's. I'm like,
Yeah.
you don't have Parkinson's. You have a intentional tremor.
Yeah.
You have a bad B12 deficiency.
I love
We had to
B12.
respect her soul. And she had a B12 deficiency, so it wasn't Parkinson's, in my opinion. We'll see. But, man, it's a B12 deficiency.
Yeah.
B12 deficiency is the big mimic of a lot of different similar type diseases and symptoms. So you got to rule it out. You got to make sure it's not there before you jump to the diagnosis. You go, you have Parkinson's. You're going to die in about 7 years. What? No. The B12 deficiency.
That's
Which you won't die from, and you're going to be better in about 7 months. Okay,
Yeah.
so.
I love B12 too. Helps with canker sores. Sorry.
Yeah, it
Random
does.
thing, but
If you have canker sores, take Super B.
works so good.
That's a B vitamin deficiency. Take Super B.
It's amazing. So next question. I don't think they've been here because they don't understand the acronym. So MTHFR,
Methylene tetrahydrofolate reductase enzyme deficiency disease. There it is. Okay. So,
PCOS.
polycystic ovarian syndrome, though only 32% have cysts. The rest just have high testosterone, massive insulin resistance, and high blood sugars and stuff. And they gain a lot of weight and really muscly, like super women. But really, in reality, it's they have other methylation problems. They probably have compound heterozygous MTHFR. I'm going to see if that bears out. I'm going to keep checking PCOS patients for that. By the way, if any of you or you know anyone who has NAFLD, non-alcoholic fatty liver disease, or non-alcoholic steatohepatitis, NASH, or NAFLD, it's MTHFR that causes that. You deal with the MTHFR and the NAFLD or the NASH goes away. Just throwing that out there for everyone. You probably just lost everyone in the crowd, but
More acronyms. Those are great.
yeah, more acronyms.
You're
Sorry,
just
doctors
frustrating
love
everyone.
acronyms. Yeah, sorry.
Just kidding. So next question is a 56-year-old woman. Her estradiol is low, testosterone is 13, DHEA
Whoa.
low, major
Whoa.
hot flashes, progesterone's 25. She takes progesterone plus, testosterone compound, Pmdd 20, anything else, and also her copper tested really high.
But does she have fibromyalgia symptoms?
She
You
didn't
can have
say.
high copper and not have fibromyalgia symptoms. So, high copper through the NCC, the non-steroidal plasma-bound copper levels. If it's high, I guarantee you have fibromyalgia. That's how you diagnose it. So, and that's the way we're starting to diagnose it. So, what does she want? She needs to take more of everything.
She's just wondering anything else.
More.
Stronger. More things.
Stronger. More. Someone's whimpering around
Start
with her.
bathing in the
Doctors
Progesteron
often will treat patients, will medicate them according to their own satisfaction, not the patient's. Patient will go, I need more thyroid. No, you're good. It's good. And the patient's like, I don't feel good. I need more thyroid. I still have cold hands and feet. The doctor will go, well, your labs, they look okay. And they're within normal. Yeah, barely within the lower limit of normal. And that's not even normal. That's just bogus. But, and the doctor's like, I feel good. You should feel good. The patient's like, I feel miserable. I'm going to find another doctor.
Go crawl.
And then they call me. So,
yeah.
Okay, just an example. Crazy.
That's good. No, it's sad. So someone is talking about their mother who's 73 and suffers from migraines daily. Is there any hormone support for that or any other recommendations?
Could be progesterone, but check a SpectraCell, HSCRP, all that kind of stuff. I get a SpectraCell. I bet too, if this person's getting a lemon distributor, her mom probably has MTHFR. I see that. I see a lot of migraines caused by that from lack of B12 or folate. It causes vascular inflammation. I'd get a homocysteine level on her too, so she doesn't have a stroke or heart attack. I'd definitely be all over that because it's a big stroke risk at 73.
Yeah, that's really big.
Which is a really common cause of death for women. It's the number 2 cause of death.
Yeah, I was gonna say 3, but you're probably.
It's in the top 3.
It's crazy. So you mentioned fibromyalgia a little bit, and so they're wondering what you recommend for fibromyalgia. I know that was 2 weeks ago.
Watch my video.
You'll learn a lot.
Watch the videos from a couple of weeks ago, or whenever that was, 2 weeks ago.
It's on YouTube, right?
Well, yeah, YouTube,
And
everywhere else.
And
Please
here.
watch it. Facebook, everywhere else. Watch my video. It's copper toxicity issues because your copper metallothionein is dysfunctional. So copper gets in the wrong places. Copper metallothionein can be dysfunctional from a boron deficiency, a molybdenum deficiency, a B6 deficiency, a zinc deficiency. It can be in a whole number of things, or a lack of glutathione, so glutathione deficiency. So we have a product called Copper Balance that we give, plus we have our patented, soon-to-be FDA-approved glutathione. Yeah, we're taking it through all kinds of indications for drug approvals. So. And we're moving in that direction quickly, but the supplement will always be available. And supposedly there's a company some of you know and love that's picking that up in the fall. I'm not saying which, so you already know who it is. But okay, so and you'll be able to get it at distributor pricing. I think it'll probably blow up Young Living. So that's my opinion. I think they'll get a massive number of new people signing up for that, especially when it starts. The things it really does come out through FDA studies and published studies. So
It's exciting.
yeah, it's crazy. Yeah, we should become Young Living distributors, but I can't. So, and if you sign me up, I will find out who you are and have to remove my name. But so many people have signed me up over the years, I have to go undo it and go, why did you sign me up? Who are you?
They just get so excited.
No.
They're like,
Don't
I have
sign
Dr.
me up.
Crusher in my
I can't do it
underline.
because I make products for Young Living.
That's so funny. So back to MTHFR. This question is, are any of your MTHFR supplements okay for people that cannot take any methyls? Is that?
Never heard of it. We can't take any methyl. You'll die if you can't take methyls.
Yeah. I saw
Metals or methyls?
Methyls.
I don't know what that means. Maybe they said ethyl.
It
Was it methyl?
I don't know.
Kind of. Okay, I just thought it because I'd never heard of that either. So.
I remember I'm kind of the foremost knowledge on this stuff. I've never heard of that. So I don't know what that means. Someone's smarter than me, clearly, out there.
Mm-hmm. Is there a correlation of hormone deficiency and clonal seizures? Is that a word? That I'm saying right?
Not to my knowledge. I have seen seizures with high copper levels, with bad fibromyalgia, and it goes away when you correct your copper dysfunction problem with correct your copper metallothionein. It goes away.
Is treating a postmenopausal woman with testosterone approved by the FDA? Is a question someone asked. I don't know.
Yeah. They don't have to approve it. It's supported by the medical literature. Yes.
Just a thing, yeah.
Yeah.
And then someone else was wondering, why are there so many cases of Mthfr? I know you've explained this before, but people love this.
I don't know. In Utah, it's because everyone has blonde hair, blue eyes, which is kind of weird, but it's from Norway, Denmark.
The Vikings.
It's really common, Vikings. My wife's family's from Spain. Your ancestors are Spanish royalty in Zaragoza, and they have blonde hair, blue eyes, but those are Vikings that settled there too. So it's all from one person, like way back when. So
yeah. Is there anything that can be done for a teenager with brutal period cramps? Doctors just want to recommend birth control.
No. So wow. Prior to age 18, if you take birth control pills, it gives you, this has been confirmed in 2 studies out of Europe that are really suppressed here in the U.S., but it gives you a 500+% lifetime risk of death. So 500+% chance increase of lifetime risk of death, not getting breast cancer, but death from breast cancer, lifetime risk of death, 500+% chance. You are screwed if you take birth control pills prior to age 18. That's why we're seeing that bimodal peak in breast cancer breast cancer cases. Used to be everyone peaked at 65. Breast cancer peaked at 65. Now there's one in their 30s and one at 65, so it's bimodal.
Yeah. And
no one can figure it out. Well,
got it.
It's all the birth control pills in young girls. So don't do it. Yeah, lots of natural progesterone. Yeah, and if you can't get help in that area, call me. But ask your doctor for compounded progesterone, not cream. It won't be enough. Creams don't work in progesterone. But capsules, compounded capsules, 200 milligram capsules, that girl will be taking them and love them. So, but if you can't get help, call me. I'll help you.
Yeah.
Are we almost done?
Yeah.
Why is he whispering?
It's getting late.
Okay, everyone's tired. Did we run out of questions?
No, but let's do another one.
Okay,
Let's
one
keep
more.
On. No,
Last one.
Let's do another one in 2 weeks.
Real quick, there's that follow-up with the methyls.
Oh.
If you just want to
Yeah,
read that.
she said, I thought it was methyls that couldn't be taken, so they usually take folinic acid instead of methylfolate. Sorry for the confusion. Is there any supplements that are okay to take?
Yeah, our Mthfr Sport Plus is folinic acid, which is the precursor for folate or methyl, and it has no extra methyl groups added to it. Though there are some in there, hiding in there, which is good, but you need some, especially if you have Mthfr. She's worried about over-methylating.
Yeah.
Yeah. Try the Mthfr Sport Plus.
The Plus.
That's why we designed it.
I like that one because I over-methylated easy on the support. So
yeah.
It's really good. So,
that's it.
Yeah.
I'm done with my peeps.
Let's plug yourself. Where are you at? Are you on Facebook?
I'm on Facebook. I have emails, Twitter, Pinterest, Instagram.
All Dan Purser MD, at Dan Purser MD.
Yeah.
His YouTube is Dan Purser MD. You can
all Dan Purser MD. And if you find me on Facebook, please, it's the Dan Purser MD one. Like it because my Dan Purser's been full forever. It's got 5,000 people, and occasionally someone dies or leaves the country, and they get off Facebook, so there's a slot open, and suddenly I have 85 people who want to get that little slot. So just like me on Facebook, Dan Purser MD. My books are at greatmedebooks.com because I write great med ebooks. Anyway, whatever. Okay, so please get my books if you have questions because it really answers a lot of your questions. Essential Oils and Menopause, the Female Program 120 Handbook B is the one you want, and my books on estradiol, osteoporosis, and progesterone are excellent. If you haven't downloaded the 30 plus benefits of optimizing testosterone levels for women PDF, please do it. I'm going to turn it into a book. Then you don't have to pay me for it, so it's easier to do it now. So, And if you like any of my books and read them, please leave me a review. It really helps pay it forward. If you like any of our products, leave me a review. And remember, October 4th through the 5th, I will be in Bloomington, Minnesota with Star Mori. If you and your team want to go up there, please connect with them and tell her you're coming. You're bringing 72 people or whatever. You're bringing 27. Get your tickets in advance. I'm trying to force her to get a bigger venue. She's gonna hate me, but she asked for this. I'm gonna lay it on her. So, and I can say hi to y'all. I like to shake everyone's hand that comes to my events, and this is my only event I'm doing here for this year for you guys. So, anyway, it'll be fun.
Don't forget to watch your past Facebook Lives that you've done. Just last week, 2 weeks ago, you did on fibro.
Did on fibromyalgia.
And there's a great fibro help page called End Fibro with Natural Options.
Oh yeah, that's my fan page, in Fibromyalgia with Natural Options. Mm-hmm. That's my fan page set up by the mysterious Lois Schweigert. She's not that mysterious. She's one of the first. She's one of the first people I cured. I didn't cure her. I can't cure her, but I got rid of all of her symptoms. She keeps it at bay with fibromyalgia, and so she shares. She thought she needed to share the world. She's hardworking, but she wanted to do this crazy thing and help everyone. So I go on there occasionally and hang out. I think that's it. I'm probably boring everyone, driving me crazy. We'll try and go through and answer some of these questions, but I think I did it pretty well tonight.
Yeah.
You can use a cream if you're postmenopausal, PD8020 or Prenolone Plus cream, or PD8020 capsules, and a testosterone cream if you're having problems there. If you're premenopausal, it's a vitamin deficiency or a genetic thing, almost always. It's rarely pituitary, but it occasionally is. So, or it's ovarian problems or something like that. So there it is. That's the issues. So I love all you guys. Take care. God bless, and go in good health.